I'm really happy to be here. I actually didn't know I was speaking here until August when Al and I were on the phone, and he said, "Hey, you know, you're speaking at IABDM." And I was like, "Really?" Well, I had an evil assistant who made the arrangements and everything and never related it to me. This is someone, I don't know if you've experienced this, but there were employees, and she was a new employee, and she was trying to get fired. Like she was trying to get fired, like she didn't show up for work for 2 days, and then I'm like, what happened? Then she had this whole story. Well, anyway, part of it was sabotaging that, but thanks to Al, I am here today. And I'm really excited to be here. I love this organization. I love that there is a biologic registered dental hygienist program. I'm here, I'm gonna really kind of rock the boat here because I loved what everybody spoke about, and it all ties together, and then there are hopefully a few things that I can break through with, because I'm gonna tell you the truth. Most people who call themselves biologic really don't understand what that means. They think, oh, I use ozone, oh, I do safe mercury removal, oh, I take out infected root canals, oh, I do cavitation surgery, and I do biologic dental hygiene because I use ozone and lasers and da-da-da-da-da-da-da-da. That is not biologic. So I had my first wake-up call when I came out of dental school in 1983 at the age of 12. So, I'm a little older. I knew that I was, as many shared the same feeling, that I felt like I was a very good mechanic of teeth, but I really wanted to be a physician of the mouth. And so I enrolled in a program by a Dr. Alan Pressman in New York. It was the first master's program in holistic health. And Dr. Pressman actually, it was a master's certificate course, the first of its kind, and I was the only dentist there with a colleague of mine from dental school. And then from there, I felt I was aware, but I wasn't calling myself a holistic dentist. As a matter of fact, I didn't come out of the closet as a holistic dentist until I went to Germany and Switzerland, which was after I actually, in 1996-97, there was a program in complementary and alternative medicine being given by Harvard Medical School. And I was like, oh, I'm going to that. And it's funny, I was there, and I was the only dentist, again, in 1996, 97, learning complementary and alternative medicine. And then from there, I heard about a man named Thomas Rau, who's recognized as probably the father of modern biologic medicine. He started a clinic back in the 90s, late 80s, called Paracelsus. Some of you may have heard of. And lo and behold, I would be going to this clinic, and the first thing Rao would do, and there were patients of mine had breast cancer, prostate cancer, autoimmune disease. Lyme disease wasn't ever really very understood in the late 90s, but they would go there and they'd come back healed. I'd be like, what's going on? Well, I'll tell you what was going on. What was going on is the first thing he zeroed in on and cleaned up is exactly what Hal Higgins was talking about in Colorado, which was your mouth. You got to clean up your mouth. There's so many things that I'm embarrassed about that we've used in dentistry over these many years and still continue to use. The FDA has banned dental mercury in pregnant women and children. What about everybody else? It's safe for them. It's safe for, for everybody else. It's like when triclosan, which is, I'm going to show you this, and we're going to talk about this. But triclosan, which was a carcinogen, it was banned by the FDA in the 60s. And Colgate comes back and uses a lower amount, and they put it in Colgate Total to kill germs 24 hours a day. And in 2002, I began my research on the oral microbiome. And when I started studying the oral microbiome, they call it a Copernican revolution in science. A Copernican revolution. We realized the Earth wasn't the center of the universe with Copernicus. Well, we realized, oh my God, all of these scary critters, and it looked like, with friends' videos, but like I was so creeped out. I had nightmares last night of everything, the invasion of the body snatchers. But we're made of those body snatchers, and we're going to talk about that. So I hope some of the things that I'm able to bring to you today helps us understand that. This is my favorite quote, that Rene Dubos, 1965, the states of health or disease is the success or failure by the organism, us, to respond adaptively to environmental challenges. COVID really wasn't that scary. What was scary is the way we were managing it, the way we were approaching it, the entire political machine behind it. So now we've polarized our political system, and we now have a polarized healthcare system where you can't even have an honest and open exchange of real science. No, COVID wasn't really scary. What was scary is when they said this guy was perfectly healthy at 42 and succumbed, to COVID-19. He just went down. And the reality is I could have given you 5 different things that were undiagnosed, including a screwed up microbiome, a screwed up gut, a screwed up airway, where's Felix? Screwed up airway. All of these things were really, not even discussed or looked at. So, this is my favorite slide. I show this at every medical conference I speak at. I spoke to the annual program for the naturopathic physicians last week. There were 1,000. That was virtual. And they didn't even get a third of what I was sharing about dental toxicity in the mouth. And some of them refer to non-biologic dentists, I came to learn. So it was really kind of helping them wake up. We are, and I agree with Blanche 100%, and a number of other people echoed this. You cannot be healthy. You could be going to a functional medicine doctor for 20 years to fix your gut. But if you don't fix what's going on in your mouth, you are not going to really get very far. So dentistry was unplugged from medicine, and I was, whoops, where's my favorite slide? I was like, that's my emoji. They unplugged us 150 years ago. So the reason why true biologic medicine, which really originated in Germany and Switzerland, and in those areas, when you want to be a dentist, you go to medical school, and then you subdivide into cardiology and dentistry and neurology, and the way it should be. We are not disconnected from that. And so I began this practice about 20 years ago, and I said, you know what? That's it, I'm done. I'm out of the closet, I can't say. Because, honestly, I was an accomplished restorative dentist. I loved doing cosmetic dentistry. So I had the wellness doc who was doing all these programs, and then I had the beauty doc, who was doing, the makeovers to the stars. And some of them I got to sing on stage with, and that was fun. I should have brought that video. I sang with Billy Joel in Las Vegas at 2 concerts. I sang solo, and I got a standing ovation. That was one of my bucket list things. I sing when the patient's in the chair, so I was singing to him, and he goes, Dr. Gerry, you have a good voice. And I said, why? Would you ever let me get up? And he said, you wouldn't get up. And I said, no, I'll get up. So he said, I was like, I'll sing in the back, with Crystal and his other saxophonist, Mark Rivera. And he said, no, you're going out solo. And he actually stopped the show, and he was doing head-to-head with Elton John, and he said, I have a special guest. The whole arena went crazy, and they think it's Paul McCartney, Madonna, and then he goes, it's my dentist. And that's exactly what the audience did, by the way. He goes, I got my dentist here, he just wanted to get up and sing, and I got out and I banged out a Frank Sinatra tune. But, so it's been a long, strange trip over almost 40 years of dentistry. It's really, can't find. She gets hungry for dinner at 8. I may dig out the video because my wife's not here, so I can show it because she's like, you show that video one more time. So, so anyway, rejuvenation dentistry was a concept I came up with to bring. What is rejuvenation? It's not just about looking younger and slapping some veneers on. It's about living longer, healthier lives. And we look at people who live long. My father-in-law, I celebrated his 95th birthday last week. And we're in a restaurant. Yeah, I know. That's my father-in-law. I hope it rubs off on me. And there's a common denominator. His spirit is indomitable. His intelligence, his warmth, and he laughs every day. He calls to tell me a funny joke every day, and he laughs. So that's really in the spirit, and that's what I'm going to show you a little bit about what we believe. And all of us here have a unique biochemical, microbial, genetic, psycho-emotional, and spiritual composition. You know, we're really good, even as biologic dentists, we're really good talking about biochemical, microbial, and genetic. But we sort of lose it when we get psycho-emotional and spiritual composition. That's why I loved Al's slide about the woman who had periodontitis, and nobody could figure out what was wrong. And she literally quit her job, got a new job, and that is why, I talk to patients about this all the time. I talk about that healing is not just getting those bugs under control. Healing is not just getting bugs under control. Healing is not just balancing biochemical pathways. Healing is not just repairing our genes. But I have patients that sometimes that are in for cavitation surgery, and I stop. And there's one woman, she was coming up from Washington, and I said, you know what, I don't feel comfortable starting treatment today. And she's like, why? What's wrong? And I said, I don't think you believe you're going to get better. You've had Lyme disease for 4 years. Lyme spirochetes, by the way, love mandibular cavitations. And I said, I really feel you don't, I said, I want to tell you something. There's a man named Bruce Lipton who wrote a book called The Biology of Belief. What you believe can change your DNA. What you believe can change the expression of your indigenous microflora. And then I told her the fifth connection, which we never used to talk about in science. And that's this crown chakra connection to source. And we have a field. And so this expression of our field, it's like blowing up a balloon. If we're not connected here, our field will dwindle. And we see people, and you could use the expression, their spirit is broken. They've had loss in their lives, they've had trauma, they've had tragedy, and they've had chronic illness that almost disconnects them spiritually. So that's what I want to talk to you about. When I talk about rational therapies, you need to get the whole person. Mind, mouth, body, spirit. I threw, M squared. Mind and mouth. So I wrote a book that I was supposed to have here. My publisher failed to send the case. But I would like everyone who attended to get a book. And so the second thing we believe is that there's multiple factors and causative chains that lead to dysregulation and disease. We talk about a lot of those here. Toxicity, nutritional deficiencies, inflammation. And the third is my favorite. There is an energy or vital force. So that vital force is also called your spirit. Ayurveda talked about it forever, prana. Chinese medicine, qi. We in Western medicine, we call it spirit, and we thought, oh, that's religious, that doesn't belong here. No. It's just as essential a component of you, and that's why when I really became biologic, I couldn't hold it in. And funny thing is I just thought recently, at 6 years old, I decided to become a dentist. But at that same year, before I decided to become a dentist, I went to sleep and said, God, what should I be when I grow up? And I heard a voice say, I want you to work for me. And I swear on my life as I'm here, and I never really shared that, but that voice, I went downstairs and told my mother and father, coming from an Italian-American Roman Catholic family, I'm going to be a priest. and I told you that I was going to be a priest. And the reality is that I my mother was like making breakfast. My father like was reading the paper at the table, put it down, put it back up. And my mother said, "Why do you want to be a priest?" I said, "Well, God told me he wants me to work for him." And she said, "You could work for God in everything you do. You don't have to be a priest because priests don't get married. They don't get married and they don't give me grandchildren." So that is when I went back to bed that night and I got like doctor, lawyer, and I hated going to the dentist. I visited the dentist more than my other my brother and sister. So I didn't really particularly like going to the dentist, but you know what? Since I have to say honestly, since the COVID shutdown and I got to start to look inward and like, what are we here for? I think it was an opportunity. We look at it. There's nothing that happens in our lives, I believe, after all these years, I believe there's nothing that happens. My mother used to say, nothing happens that doesn't go across God's desk. And so I kind of feel like everything has happened for a purpose. Who I've met, the relationships we've built, we're all here for a plan and a purpose. Thank you. So you see, I am a priest. and I get to talk to people like I'm speaking to their vital force. And it has such a difference. There's a great book. When I came out of dental school, I read a book by a physician by the name of Dr. Bernie Siegel. And he wrote a book, very brave book. It was called Love, Medicine, and Miracles. And it was very brave to speak out like that because, he's a kook. What do you mean miracles? There's no miracles? Oh, not really. There are miracles every day, every second. So it's important for us to treat the individual and not just those bacteria swimming around. We have to treat the individual, and it's a multifactorial individual. And so this is what we do. We become synonymous with the principles of biologic medicine. And so what I did is I put medicine and dentistry together. This is a new office. Thank you, Plandemic. Thank you, Plan Riots. Thank you, Plan Election. I love that I bought this for 50 cents on the dollar, John. And we're putting all your filters in all the rooms. But we have 2 physicians, an amazing naturopathic doctor, 2 RNs, 2 energy workers, and 4 biologic dentists. And so this is a model, and I'm doing this as a model. By the way, I saw this oval in a dream, and I said, oh, it'll be an entrance oval. Nobody waits. There's no waiting room anymore. There's a greeter at that podium. And this is somebody maybe waiting for an Uber outside. But nobody waits in the waiting room. They go right into these little VIP suites where they're attended to with amenities and things for them. There are 2 recovery areas. We have lymphatic drainage. I want to put hyperbaric oxygen. But dentistry belongs with medicine. We need, and so physicians are trying to put dentists in. I'm going the other way. I'm trying to put physicians with us because, by the way, we're on the front line. We're the quarterbacks. And because the physicians, they don't get it. They really don't get it. They still don't get the mouth. But we, and in biologic dentistry, I think biologic dentistry and naturopathic medicine belong together. I know there's, Phil Malika does a program and gives you a little something, but I think you need somebody who's really, really gone through the entire naturopathic foundation. My what? Oh, the trees, yes, life. I'm actually bringing trees into the space. They're not going to be like that. They're real trees because it's, we have 12 windows on Central Park, first floor, with views into the park. And my wife is like, why are you doing this? You're going to be 64 and 2. What are you doing? When are you going to just slow down? And I'm like, yes, hygienist, excuse me. Excuse me, and more hygienists are welcome. Hygienists are welcome. Come talk to me. I have, actually, these 2 are new patient experience. We call them the new patient experience rooms. And so, and this is the laboratory on the premises. And we are exploring the most biologic materials. And yes, zirconia is not perfect as an implant, but it is definitely accepted more by the body, doesn't block meridians, and we're seeing some very sophisticated innovations in the zirconia market. And there's, as a matter of fact, the young man in the back over there, Dominic Marino, who has been a friend to biologic dentists all over the country, has a new ceramic implant you need to look at, and another biomaterial that's just come out that he has the exclusive representation for because he's a very smart young businessman and he loves dentistry. So, you know, it amazes me that most dentists don't even know who this guy is. They don't even know who this guy is. This guy founded the research arm of the American Dental Association. He was talking about paleo before, you know, what is it, Dave Asprey. so you know, and keto and all this stuff, and even vitamin K2, he called it Factor X. So he was the father of the mouth. I'm the grandson, and I wrote this book. This is a book I'm going to get to everybody, but I was talking about the mouth as a mirror and a gateway, bidirectionally. I wrote this for the guy on the drive-thru at Burger King, you know, just to read something and make some subtle shifts. So we know the mirror. First time I saw this chart, about 30 years ago. Well, more than that, 38 years ago. I saw this for the first time from Alan Pressman in that course on holistic health, that your teeth connect to organs in your body. I thought it was voodoo. This was voodoo to me. How does this happen? Well, there are meridians, energetic pathways, meridians from teeth to organs. So I had a woman, a friend of mine who's a functional medicine doctor in Houston, Texas, calls me and says a friend of hers has just got diagnosed with lung cancer, left lung. And it's a tumor that's taking up 2/3 of her lung. They're going to operate and take out her lung. And I said, well, what are you doing? She goes, I want to get her checked out, but I want you to look at her records. And I said, well, does she have any root canals? First thing. She has a root canal on tooth number 19. Yes, true story, true story. And I said, have her get that looked at. She should get that out. She goes to her dentist, the woman who, the dentist, and she goes to the endodontist, and they're both looking at a 2D film, 2D, and they're going, the fill looks perfect. There's no reason. There's nothing on the X-ray. X-rays, you could, I mean, they're toilet paper now. Okay, 3D. X-rays are good. Excuse me, for bone levels and in hygiene and for C caries and approximately stuff like that. But 3D for something like that. So I do a 3D scan in New York. She comes up to New York. She's got a giant black mass between the two roots. I remove the molar. We do ozone, laser, PRF, with a little bone graft, bone mineral. By the way, PRF alone in cavitations is not enough because PRF resorbs faster than the osteoblast, than the mitotic. We'll talk about that a little later. But anyway, I take this out. She goes back for her pre-surgical workup 5 weeks later. And they're like, oh, no, we don't understand this. The tumor has shrunk to 25% of the size. But you're in for surgery. Let's not wait anymore. Let's take out just a little piece of your lung. So they did a lobectomy on her left lung because she was scared into it. And I'm like, no. All we do with that vital force is eliminate blockages. And those blockages helps the body heal itself. We have this divine ability to self-regulate and heal. That is the foundational principle of biologic medicine. So the tongue, you know, I mean, Chinese medicine has always used the tongue. Everything from vitamin deficiencies to candidiasis, and even atrophic glossitis, excess bacterial. I mean, the tongue is an important diagnostic organ that is not looked at enough. Not to mention tongue tie, which we never looked at until recently. So as a gateway, yeah, you know, we have this thing, the periodontium, the circulation to the distal sites, right? And we even look at it, and it's all about the oral microbiota. And this is the amazing thing, the link of an imbalanced oral microbiome an imbalance in the microbial flora or a lack of microbial homeostasis, that combined with the corresponding inflammatory pathways to even creating a more inflammatory genotype, but then cancer, gum disease, precursor to cancer. And not to mention Alzheimer's disease, atherosclerosis, diabetes. We all know this, right? And we have this imbalance, balanced microbiome, imbalanced microbiome, and the notorious, P. gingivalis is always showing up, and Fusobacterium nucleatum. They're like, Fusobacterium nucleatum is like the big bully, the big bully in the neighborhood, who behaves when he's in a balanced environment. When he's not in a balanced environment, he wreaks hell, and he carries P. gingivalis on his back, right past the blood-brain barrier, too. That's why you see neurofibrillar bundles and amyloid plaques being formed in the brain with P. gingivalis. And even worse, impotence for men. So, cancer, diabetes. So we see all of this, we know this, we've seen this 100 times. But this is where it gets real. This is actually 2019, where chronic inflammation has been associated with several diseases, several systemic diseases like cancer, and that inflammatory mediators produced during periodontitis development could mediate carcinogenesis, or periodontal bacteria exert its effect directly in transforming cells, which I believe the second is, in the latest research, that's the second is, the second pathway is being identified as more prevalent. Basically, you have, denatured DNA being caused by chronic inflammation, chronic periodontal inflammation. So it causes us to pay attention. We could add, by the way, colorectal cancer, oral cancer. What else is missing? There's a few others missing on that besides those. Bone marrow cancer, thank you, doctor. And these are the facts, I think Al had like 92% of adults, and didn't you have? You had a 90%. But this is from the Colgate-Palmolive website. 80% of adults over 35 have some form of gum disease. That's right, from Colgate's website. Well, guess what? That statistic hasn't changed in 39 years. So what's wrong with this picture? 39 years. 80% epidemic? And it's costly. I'm going to show you a slide of how costly. So how do we get from the left to the right? Or how do we go from this? This is one of my favorite analogies. These are these beautiful brownstones of Brooklyn. How do we go from that to that? Yep, your mouth can be a ghetto. So how do we get it back to being a well-kept, orderly, and it ain't by nuking the biofilm. And I'm going to have a lot of pushback here, but you've got to respect your microbial flora. You're made of them. This was the cover of Time magazine. I think it was 2004, which I loved. Gum disease was identified as among the body's number one epidemic, number one source of chronic inflammation, with links to heart attacks, cancer, Alzheimer's, and other diseases. And that was like 2004 or 2006. This is a book I read in the Harvard program by Paul Ewald about stealth infections, which was basically saying the same thing, right? So you have chronic inflammation from periodontal disease, doesn't hurt, right? And the patient goes, oh yeah, my teeth always bleed when they brush. All of us, I think 3 of us or 4 of us touched on that. Like if you brush your hair and your scalp is bleeding, you think like, oh, it always does that. So we laugh as biologic dentists because we know how absurd it is to think that bleeding is like, oh, I just brushed too hard. No, No, believe it or not, your gums are pretty resilient when they're healthy. So let's talk about this ancient relationship, because if there's one thing I really want to drive home, it's what I've spent the past 20 plus years really doing the deep dive in. And I named actually a clinical research wing at NYU. There's a Curatola wing for clinical research. Now I'm working on the biologic wing with the breast. I'll do the breast, the biologic breast. Wing, breast, thigh, I don't know. Nobody got that one, all right. Anyway, I know. So isn't it funny how a bacterium and a mitochondria are the same shape? They hold the genetic information and they divide kind of the same. And scientists say there are 10 times the number of bacteria than human cells right now. And there's 100 times the genetic information from the bacteria, from the microbe, than your own human cells. That's what the Human Microbiome Project uncovered. But I always was stuck on the fact that, there's a verse in ancient Torah that says, "And the Lord thy God took from the dust of the earth, and he breathed his spirit into it, and we became mind, body, spirit." And I was like, how could it be dust? Like the dust like my mother cleaned off the bookcases in the den? God took dust? Why would he take dust? No, I was with a guy who was a Hebrew scholar, and it was either at an IABDM or it was one of these meetings. And he was a dentist, and I don't know who he is because I never saw him again. And he told me that he had studied the Aramaic and the Hebrew and all that. And you know what the word is? It's not dust. The real translation is slime or sludge. The earth was covered with microbial slime 3 million years ago. Before we were here, the earth was covered with microbial slime. I believe the microbes in our bodies right now do everything from making neurotransmitters for our brain, from determining the color of our eyes, what we were going to look like, and even picking who we're going to marry. And everybody laughs when I say that, and I'm like, well, the microbes produce pheromones, which determine sexual attraction, and, indirectly, that could lead to who you're going to marry. And sometimes they make a mistake, but that's beside the point. Be that as it may. The reality is I believe there was a cosmic event. Whether you're a creationist or an evolutionist, I believe that these microbes became engulfed in a cytoplasm, became organized with an intelligence that was beyond us. And that's our connection to the cosmos. Our microbial flora is our connection to each other. It's our connection to the cosmos. And it's been terribly misunderstood. And too many in this room remain in the mindset that they're invaders and they're bad, and get rid of them because these are bad bugs and these are good bugs. And I'm here to tell you there's no such thing as a good bug and a bad bug. There are bacteria that behave well, and we call those probiotics, and there are bacteria that behave bad, and we call those we call those pathogens, right? So very, very interesting when we start to look at it from a different perspective. So these are my commandments. 1, we are made of microbes. Basically, we're walking bacteria containers right now, even with our human cells, which may have been microbial in origin. 2 kilograms. Right? 2 kilograms. The microbes control us. We do not control them. We have always lost the antibiotic war. And that's why from when I became involved in organized biologic dentistry with IAOMT, IABDM, and everybody's talking about ozone, everything. Ozone the shit out of everything. And then you'll be okay. Because then we're going to kill all of that stuff that's swimming around in there. No. Because if you go to war with your microbes, you will lose. And to stay healthy, this is my mantra. And everyone should repeat after me. Make peace with your microbes. Together. Make peace with your microbes. Because they're keeping you alive right now. If we were successful in nuking the oral microbiome, we would have unleashed ecological Armageddon. Have we got that? Just like we do to the gut, Al. We nuke the gut in so many ways. There's so much misunderstanding, and it is the big brain. I mean, Al Dannenberg and I, it's funny, we come from two different orientations. Al is like, if your gut is out of whack, your mouth's going to be out of whack. And I really think it's bidirectional. That's bidirectional, not bisexual. I'm not bisexual. All right. Amen. All right. So this is what we should be asking, how's your microbiome? Because in 2009, this was probably one of the most powerful paradigm shifts. This paper in the Journal of the American Dental Association was a paradigm shift. Because prior to announcing that periodontitis is an archetypical biofilm disease. By the way, the word microbiome was made up by a renowned microbiologist from Tufts University. His name was Josh Lederman. And he came up with the term microbiome. But before that, we called it a biofilm. So biofilms, the microbiome is a biofilm. It just sounds nicer. It sounds like one of those domes and all that. But this was a shift from a bug-oriented approach to perio to a terrain, to evaluating the terrain. It's all about the terrain. The terrain. It's like all about the base, all about the terrain. The terrain, terrain, terrain. Everybody should repeat that, right? So here we have a happy terrain. Here it starts to become a desert over here. This is what happens when you use charcoal toothpaste and you oil pull every day. I can't get patients to brush for 2 minutes, but they say they do oil pulling for 20 minutes. Like that's magic, okay? So listen, oil pulling creates a lipophilic detergent effect, okay? And I'm telling you want to do it for a few weeks, clean things up, reduce the amount of biofilm in the mouth. That's fine, because it's not really nuking everything. It's just a detergent action. So here is the target. Here is where we have lions, tigers, and bears, and Fran slides. Okay, here is Fran slides, and it is, and we have the treponema. They look like fusilli. I know. I started saying pasta shapes. It's me. But this is where we get to. But what's interesting, and this is in my book, this is one of the pages in my book, because I want people to realize that you want to be in the center of the target. And you want a big dotted line, because a small dotted line is weak host resistance. And so your microbiome can shift. So you could be really, really good and then go to a big Italian wedding and have lots of pastries and sweets. You shift the flora. But if you have a big gray line, you're able to rebalance, just like the level on, one of those levels, a little bubble on the level. You can level out. That's why I created REVITIN. REVITIN was just designed to help you stay in the circle. And I'll show you some of the research later on. But so when you shift to the right, we get the hypertrophic biofilm. What's a hypertrophic biofilm? That's thick, sticky, smelly plaque on your teeth, and it's loaded with imbalanced, pissed off bacteria, right? So pathogens, to me, are pissed off bacteria, because Fusobacterium live in the mouth. It's the most common commensal bacterium in the mouth. And you shift the terrain. So this is all about the terrain. When you shift the terrain out of microbial homeostasis, that's when you produce pathogens. That's when you get, pathogenic expression. We got to get out of, because, Gordoni and all these guys, that Blanche was talking about, they're nice guys when they're happy, when they're balanced. They don't bother anybody. It's like driving through, I remember in first year of dental school, classmate of mine's family had an Italian restaurant in Little Italy, And I, went to dinner there, and there were all these guys, these big thugs, like no necks. There's a whole table and no necks. And I went into the back, and they were all like, hey, and this was a friend of mine, Eugene, and they were all like, hey, Gino, how you doing? How you doing? I'm like, these guys are scary. And he goes, oh, he's a teddy bear. And, they were like, when'd you get out of college? And I'm like, he went to college? Yeah, Sing Sing University, So, but anyway, so we have a very complex community. And this community, this terrain can shift. And these are the rational approaches I'm going to leave you with today when you talk about how to shift the terrain. So when we start to go toward the hypertrophic biofilm, and you also have atrophic over here. So this is like a desert. That's like the biofilm behind your ear. Okay, very good. Now we do things that nuke this. Okay, so if we're ozoning. Every time they come, we're ozoning. Okay, you're going to be really stressing that microbiome. Fortunately, those bacteria are incredibly resilient. They'll be pissed off, but they are resilient. They took plaque off the tusk of a mastodon, frozen in a glacier. They put it on a petri dish at body temperature. And the study, and it started to open up and flourish after thousands of years. Okay? So kill plaque, kill germs, Listerine, kill germs on contact, kill plaque, kill plaque, kill plaque. I mean, when I developed REVITIN, we did a focus group with prominent dentists in Atlanta, Georgia. And we went in there, and they're like, you know about the microbiome? And they're like, you know about biofilms? Yeah. And then it was, well, what about the idea of a beneficial biofilm that aids in digestion, that actually helps your teeth heal? Do you know the microbial flora of your mouth takes minerals from saliva when it's in balance? It takes minerals from saliva, and your teeth remineralize naturally. You don't need chemical fluoride. Wow. They drilled that in us enough, junk science of fluoride. So if you think about it, the microbiome is an intelligent semi-permeable membrane. So I'm going to give you just right now a little dry spell, but important information about the science of the microbiome. So it's all about microbial homeostasis. So if it's unbalanced or imbalanced, the early colonizers, okay, what were you talking about? And Blanche was right. Just because they're aerobic doesn't mean they're good for you. Because if they're out of balance and you have a pile of them, okay, the early colonizers get matted down and convert from aerobes to facultative anaerobes, and that's a key word, facultative anaerobes. These form the soil. And that's the favorite naturopathic expression. It's not about the seed, the bacterium. It's about the soil, the terrain. So this is the soil where fusobacterium start to take off, and so do lots of spirochetes, because the terrain has shifted. So these opportunistic organisms pile up and destroy the architecture of this beautiful green and yellow basal layer. And so you have an entirely different metabolism. And this is where it gets really interesting, because this is what I think a lot of biologic dentists don't understand. Biologic hygienists, biologic practitioners, okay, that the oral microbiome is essential for life. It's essential for protection against deadly viruses and bacteria in the environment around us. It protects us from everything, and a lot worse than coronavirus, too. It's an essential component of mammalian digestive pathways. Essential component of salivary, what? Immune system regulation. And I'm going to tell you that when the microbiome is out of balance, your immune system is deregulated. And when your immune system is deregulated, it will also cause a loss of microbial homeostasis. So the emergent science now refers to this community in your mouth as an intelligent semi-permeable membrane. And here's what it does. It exchanges with the structures on which it sits, and it can be a storehouse. So when it's in balance, it is this incredible whole community of remineralizing teeth, keeping the streets in good shape, making sure there's no potholes, and making sure the sidewalks are swept. And it also takes waste products away, what we call ionic oxygen or reactive oxidative species. So you have this entire metabolism of it working to help you. And it's interesting because it's either a storehouse or a deficit, and that becomes a product of either microbial homeostasis or a loss of microbial homeostasis. Here's the perio part. Bacteria in an unbalanced microbiome secrete ionic oxygen. And this ionic oxygen is damaging. It pokes holes in cell membranes. And then it gets the cytoplasm to leak out. It's amazing to see amoeba action, gobbling everything up. But this is when you start to see this. So it's all about balance. But there's also a change in assumptions, how we should do that. So I was on the Martha Stewart show in 2011, and she said, "Oh, I understand you're doing research in oral care, and what are you doing?" I said, "Well, Martha, toothpaste was developed by soap makers like 150 years ago." And I said, basically it's flavored detergent. My mother said if I said a bad word when I was a kid, she'd stick soap in my mouth, but I'm brushing with it. I said, and then, in the 1970s, we started to identify that, we had to put bug killers in there. So we had to kill those germs. So everything became kill germs, kill germs, kill germs. And then what I said to her right there, and it came to me, I didn't even think of this beforehand. I said, I think it's time for doctors to get out of the pesticide business. And what I'm promoting is organic gardening for the mouth. And it just came out like that, and she loved it. She's been a REVITIN user. She's really, it is. We have to get out of this. And by the way, there's no difference between triclosan and tea tree oil, okay? Even if one comes from a plant and the other one comes out of a factory. And the interaction between the oral microbiome and Al actually, we had a discussion about this at lunch yesterday because he was like, this study where they saw that, for example, here's the thing. It's like, how do imbalanced pathogens leave the mouth and get to the rest of the body? I found it interesting because I actually think it's, sorry about that. I think it's bidirectional. I think people are using a lot of acid reducing, because the theory is if the bacteria get into the stomach, it's killed by the hydrochloric acid. But a lot of people are using protonics that reduce stomach acid. We're seeing bizarre bacteria end up in the intestines that don't belong there. And of course, right here, we have Klebsiella pneumonia, 2A7 linked to ulcerative colitis and Crohn's. So it's not just the one-way pathway. We have a digestive tract or a bloodstream. And so this gets interesting because now we're starting to see dysregulation of the immune system. After coming through a global pandemic, your patient should wake up when they realize that an imbalanced oral flora is very connected to a compromised immune system. Can you come and do that to my back after? While I'm speaking, I'll just stand over here. The other interesting thing about our microbial flora, our beneficial microbial flora, is that it compartmentalizes. There's a stratification of it, and it compartmentalizes. There's this very, very sophisticated relationship of the oral microbiome with our immune system. And when we see imbalance, we see, and this is the most, in my opinion, there's two, and I think Blanche said this in her talk, the two most notorious, I think, bacterium in the mouth. One of them, is Fusobacterium nucleatum. I mean, basically, you have everything from adverse pregnancy outcomes, preterm birth, stillbirth, neonatal sepsis, GI disorders, colorectal cancer, inflammatory bowel disease, cardiovascular disease, rheumatoid arthritis, respiratory tract infections, Lemierre's disease, and Alzheimer's disease from one bug, So, and this is by the way, this is a great paper. Great paper that gets into it. It's one of the most abundant species in the oral cavity, and it's the #1 bacterium in colorectal tumors. So, and it carries P. gingivalis on its back. But this is the bigger thug. Yes. Yes. Yeah, but actually, we're going to have IABDM is going to have all the slides and everything. You guys will have access to everything. I know I was trying to take a couple pictures of Blanche and Al's and Fran's thing, and the truth is, I love there were only 4 of us, and we're all kind of connected because we're all, in the same church and getting in the same pew. So, but yeah, I'm happy to share all of these with you. What's that? Synagogue. Okay, synagogue. House of worship. House of worship. All right, so let's talk about the approaches. The first thing that I love that Al said is that every dental hygienist here should get a 3-day diary, food diary. Food diary, 3 days. Oh, how's your eating? Oh, it's great. Oh, it's great. Okay, would you mind? Let's do 3 days, because you know what? We're not here to just treat the symptom of your problem. We're not here to just ozone you and da-da-da-da. We're here to get to the root cause. And the root cause starts with what you're sticking in your mouth. And then the second thing is we have this whole toxicity endotoxin production, which every dental hygienist, of course, should screen for. And the third, over 1 billion people on the planet suffering from obstructive sleep apnea. Yeah, Tommy died of COVID, and nothing wrong with him. Tommy was he had severe OSA, wasn't filtering anything through his mouth, and through his nose, wasn't even producing nitric oxide in his sinuses, and he's just sucking everything in, unfiltered, into his lungs through his mouth. And his blood oxygen level. I had a big strapping Marine come to me. We'll talk about that. He had hypertension. And he went to his conventional VA docs who were putting him on 2 or 3 blood pressure medicines for the rest of his life. We fixed his obstructive sleep apnea. His blood pressure is normal. So we'll talk about that. Harmful oral care products, we're going to talk about that. This has been, this is, oral care. It's really so bizarre, especially the majors. The majors, it's $40 billion a year, and so there's no impetus. Colgate paid for a lot of the studies on the microbiome research at the University of Montana Bozeman campus. They paid for a lot. They paid to learn that you don't want to kill. You don't want to be using triclosan. And you don't want to be, and they paid for that, and they were like, okay, thank you, bye. They did. Oh, we're going to get that. We'll talk about that. That's equally harmful. I put that under harmful oral care therapies, fluoride. But this is interesting here, lack of exercise. It causes imbalance of your oral microbiome, Healthy exercise, and over-exercise does too. I think, Al, you refer to that? Yeah, over-exercise. And I agree with that. Over-exercise is just as bad as under-exercise. So you need to exercise healthy. You don't have to be a gym rat. And stress, okay? Let's talk about diet and nutrition. And this study from October 2016, saturated fatty acid intake, there was very close correspondence. Vitamin C, we love vitamin C. I got the 3 United States patents on oral care products with vitamin C and CoQ10, the first ones, because I think Blanche before me said, you know, if you take a vitamin, by the time it assimilates in the digestive tract, the concentrations in the tiny capillaries are virtually negligible. So telling someone to take vitamin C and having a topical application is a very different thing. B vitamins, vitamin E, but yeah, very important for the balance of your microbiome. Diet and oral microbiota go hand in hand. So what they found in this, which is really interesting, because they sequenced ancient calcified dental plaque and the dietary shifts of Neolithic and industrial revolutions. And what they found is basically the bugs, the diversity we had, the beautiful, diverse organic garden started to become much more monolithic. Modern diets, and you know, Weston Price did a lot of work on this, on nutrition and physical degeneration, and he even expounded on the fact, he was talking about epigenetics in 1917, and which is like, it doesn't only mess up your mouth, but you damage your genes, and so your damaged genes get passed on, and you have all kinds of abnormalities that are created just from your diet in your life. So, and actually, when you eat, think of your successors, okay? Because you're affecting them by bad eating too. They did a study in cats, and they found exactly, oops, going the wrong way, hold on. Yeah. So let's talk about toxicity and endotoxin production, because that really messes up your microbiome. Now you're making really badass bugs. And so we love this. This, by the way, I find this very, very, very amusing, because here you have, oh, that root canal is so crappy, let's redo it, okay? Here, oh, look, we got a little puff there, and this, right? So let's, you know, just like taking the body out of the ground and bringing the undertaker back. Okay, let's do this. And when I reflected this, look at what you got there. I mean, that's a beautiful cavitation. And so we also know about this being a source of silent infection, chronic illness, chronic inflammation. Everyone knows the word cavitation was made up in 1931 by an orthopedic surgeon who found these lesions in the jaw in biopsies where there was no fever, no pain, no swelling. G.V. Black talked about them. And were we taught about these in dental school? No. I didn't even know what it was. I heard people talking about it. You know, this was 2000, it was 1996. That's when I first started. I'm like, a what? What? Cavitation? And now we culture, by the way, we culture these. We're using some German technology, bioresonance technology. We're really getting a printout of all kinds of organisms. We're doing it with resin, because New York State is such a pleasure to work with people like DNA Connections. It's like, it's unbelievable. The only state in the United States. So yeah, we see, this is like, you know, I remember looking at this going, oh yeah, the bone didn't really heal that great there. Yeah, it didn't really heal that great. You got a petri dish for everything. Yeah, all kinds of amazing, amazing nasty bacteria and organisms. And so at first, we were using MRIs at one point, but really everybody knows CBCT, cone beam. And now there is the new Cavitao. It's not recognized, right? And I think it's great. I mean, the technology, but you know, the technology is really fascinating. But But if it's not recognized, this really, you can see 3D, right? You can see that this is not just a little thing. It's really going all the way around and, and all of this stuff. So, and then let's set this person up for a quadrant scaling and replanning. That's like peeing in the wind. Okay, here we go. That's as effective as that. Look at the color of that tissue. It is. This is like, yep. Hal is turning in his grave. All right, we have billions and billions of implants. And the reality is that the body's rejecting this from the get-go. But this study just came out. This is, I think it was March. Yeah, March 2021. The unfavorable role of titanium particles released from dental implants. Okay? Titanium is considered to be a metal material with the best biologic safety. Bullshit. It is not safe. And after you put it in, there are particles coming off to your lungs, your liver, your kidneys. That titanium oxide level is failing. And so you have a concentration of titanium particles which are directly correlated with endotoxin production. Not when they look like this. Oops, sorry. Not when they look like this, but from when you first put them in. And this is the causes of the release. Let's do quadrant and scaling, but we'll use the carbon. We'll use the carbon scalers. It's a problem. It is a problem. Fluoride interacts with the implants. Even your saliva creates an electrolytic gradient that generates particle shedding from metal implants. No metal. So there are three things about root canals which I think are, the three fundamental principles of why you see 100% of these implants, 1% of root canals producing endotoxins, and that is no way to completely remove all the dead tissue. Dental tubules are wide enough for 3 streptococci to go straight across. Each one. There's no way to sterilize a tooth like trying to sterilize a sponge. And the materials cause problems downstream, and I could go on and on. But this was a study from 2007. Endotoxins and bacteria were present in what? 100% of the initial samples. High values of endotoxins were still present in the root canal after 7 days. 7 days of laser, chemotherapeutic, hypochlorite, ultrasonic with the hypochlorite. You can't sterilize a tooth. And the pathways of infection are really interesting. Even extruded root canal filling material is a foreign body reaction, inflammatory reaction. Cholesterol crystals form from dead red blood cells that happen around an endodontic tooth, especially if a lot of dentists accidentally go past the apical foramen. And then there's a cystic lesion where the root canal is done, scar tissue healing for the root canal site. And this is my favorite. Let's stick mercury in when the root canals are failing. Oh, we got an area. Let's do an apicoectomy now. And now we're going to stick mercury into your bone and your gums. I'm going to stick it in there. That's my Bitmoji down there for that one. This, to me, is the most ridiculous idea, and this is an actual case. Crazy. All right. Sleep and airway health. We haven't really talked about this, but this is, really probably one of the major sources of microbiome imbalances, and it's something that every dentist and dental hygienist should be screening for and setting up for treatment, right? Your tongue, my favorite title of any book on sleep apnea was by our colleague here, Dr. Felix Liao, 6-foot tiger, 3-foot cage. And that's what happened. We created these 3-foot cages, especially when you have teeth pulled for orthodontic purposes, so we make everything fit. We just shrink the cage more. You weren't breastfed, you were bottle fed. Your palate is a cathedral high palate, right? High vaulted palate. And we breathe through this triangle, and when your palate is high, you have upper airway resistance syndrome. So really interesting. I told you about the case of this big, healthy Marine who was condemned to blood pressure medicine, and it was all related to his obstructive sleep apnea. But these are just, some of the things. And, everybody knows that CPAP is forced air. So this largest ovoid organ, muscle in the mouth, right? Basically, with a small cage of your mouth and tongue tie restricting the ability to move the tongue in a proper rest position, causes the tongue to sit further in the back of the throat like a rubber stopper, closing off a bottle. So this forced air is actually stretching and elongating the tissues here, making them more flaccid. What happens when you blow up a balloon too many times? And that's what happens. So once you start using this, many people get condemned to this device because if they don't use it, this tissue has become all stretched out and flaccid. It can be repaired, but CPAP, again, is treating the symptom and not the cause. So we want to fix the cause. And on the left, this is often shown. This guy's like breathing through a coffee straw. And that's after expansion. And the appliance, which I think is a fascinating one that has the most amount of science and research behind it, is the DNA appliance. There are some other good novel appliances being introduced, but this one, very interesting because their science studies have also shown that it activates stem cells and bone growth, so you can really reshape. My daughter's doing this, and her whole smile is getting nicer. She's thrilled because she's breathing better. Her smile is nicer because it's expanding the arch from this narrow arch, high vaulted palate. She got it from her mother. No, I'm kidding. Probably me. So it activates stem cells. So this isn't rapid palatal expansion. It's not, the crank if anybody had a palatal expander when they were younger. And we see reshaping of the arch like you see here. This person can breathe. And this person will have a healthier microbiome. Much less periodontal disease, if any. And yes, children, unfortunately so many kids are suffering. Bedwetting is a sign of obstructive sleep apnea in children. So is ADHD. So these are root causes that we need to identify, in our practices every day. And so we do a lot of this virtual, by the way. So we do an initial consultation and pre-screening. We do a home sleep study. We have them get a CBCT locally, and we screen people all the time. I'm getting very jealous of those back massages back there. Okay, so this is another 800-pound gorilla in the room. Everybody comes up with ideas. Toothpaste has such a bizarre history, and we just get more bizarre again. One of the most highly searched toothpastes right now is charcoal toothpaste. For some people think it's good for them because they said, charcoal toothpaste because charcoal binds to toxins. Yeah, it also strips the microbiome. So you're going to have an atrophic microbiome. It's also pretty abrasive to teeth. So I use charcoal routinely in safe mercury removal. I will use charcoal supplements. I'll use charcoal powders. But I don't believe in charcoal toothpaste. And I think it became a fad of, right church, wrong pew thinking, right? Oh, it binds to toxins. Let's use it. Let's bind the toxins in the mouth. And this is, again, where we have. But this I always get a kick out of because there's enough fluoride in that tube of toothpaste, which hopefully that child didn't swallow. There's enough fluoride in that tube of toothpaste to kill 2 children under 5. Everybody knows 1988, Procter & Gamble launched a product called Crest Sparkle. It was fluorescent blue, it had sparkles, and it was bubblegum flavored. Fluoride fatalities in children went up 280%. So much so that the FDA has a warning on any toothpaste with fluoride. It took them 10 years, by the way. The FDA warning was 1998. Can you imagine? 10 years that I started having parents in 1998 come into me and said, why is there a poison warning on my toothpaste? I'm sticking it in my mouth. And keep out of reach of children under 6 years is more than use. Now it says if more than a pea-sized amount is swallowed, call poison control right away. Poison control center right away. And then it has all this other BS, bleeding or redness lasting more than 2 weeks, blah, 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 blah. Yep. So now there are how many? 62 studies? 62, anybody got the number? On studies showing lower IQ in children, drinking fluoridated water, and lower IQ in children. I think it's 62 studies globally, none done in the United States. Yes, please. Please. Learning disabilities, behavioral disorders, rapid aging. By the way, we all know why fluoride was introduced, okay? Post-World War II, they were doing studies in Grand Rapids, and they found, wow, when we introduced fluorine, fluoride's a made-up word too. Microbiome's a made-up word, cavitation's a made-up word, fluoride is a made-up word. It's actually fluorine on the periodic table. So fluorine is the most highly negatively charged, non-radioactive element in the periodic table, the most highly charged non-radioactive element. So when you introduce it to hydroxyapatite, it blows out the OH almost immediately and replaces it with F-, which is fluorapatite. What's the difference between hydroxyapatite and fluorapatite? Anybody ever do physics studies on that? Hello, I found them, and I really need to put them in the lecture. Fluorapatite is 37% weaker than hydroxyapatite. It is very, very hard, okay, like glass, okay? Very hard, you can't scratch it, but I drop this on a cement floor, and it breaks in a million pieces. So my mother in the 1980s tripped on the front steps of our home, and the front steps were carpeted in the house going up to the bedrooms. She tripped and fell down. She didn't have a bruised hip, she had a broken hip. So in the 1980s, Journal of the American Medical Association, New England Journal of Medicine, they started doing, the orthopedists were like, fluoride makes teeth stronger, it must make bones stronger. Hip fracture rates, by the way, all this is on fluoridealert.org. Hip fracture rates went up exponentially with the introduction of fluoride. And this, by the way, we all know that most of the fluoride placed in municipal water supplies is basically a toxic waste. And yet dentists and dental hygienists get brainwashed with junk science. Over and over again, it has to stop. We know it doesn't work. We know drinking fluoridated water does nothing to pits and fissures of teeth that may have incipient decay. And we also know that a healthy microbiome can enable those pits and grooves to heal, that incipient decay. Past the dental enamel junction, we're talking a different story. But incipient decay in kids and this and that, we do not need sealants. What we need is good diet and nutrition and good home care and a happy microbial flora in the mouth. So triclosan to me was one of the worst
Triclosan was one of the worst things that got put back into consumer products. So Colgate took the lead from Procter & Gamble when they announced Colgate Total. They were going to call it the first antibiotic toothpaste. That was one of the campaigns. They were going to call it the first antibiotic toothpaste. And then there were more studies coming out. There was a microbiologist up in Tufts University who was sounding the alarm on antibiotic resistance. And there were a lot of reports about MRSA, methicillin-resistant Staph aureus, and that the overuse of antibiotics, Colgate dropped the antibiotic thing, the antibiotic story, and they came out and said, oh, it kills germs 24 hours a day, kills germs. I love when they refer to the indigenous flora of our mouth and body and gut as germs. And then I was literally laying on a chase lounge in Ravello, Italy, and I had the international version of People magazine, and I open it up, and here's Kelly Ripa talking about my routine for a healthy mouth eliminates 15 times more bacteria to improve the health of your mouth. That is an outright lie and false advertising. Those bacteria are like a coral reef protecting an island. And if we nuke it, you don't get healthier. You do not get healthier nuking it. You need to make peace with your microbes. All right, so now I'm going to get to this is going to piss a lot of people off, but I just have to get it off my chest, okay? Xylitol is not a sugar, a natural sugar alternative. It is not, okay? It is a commercial chemical, and it was brilliant because DuPont, through their subsidiary Danisca in Europe, found a way to take a bio-waste and turn it into the new methadone for the sugar industry, right? We had saccharin, and then we had aspartame, now we got the sugar alcohols. Xylitol is a chemical that's not absorbed or metabolized by the human body. And this came out of an organic chemistry textbook. By the way, it goes through a process of hydrogenation, which uses originally, and still a lot of it, now they're trying to come up with other ways. They're saying, oh, well, our xylitol comes from birch bark, pretty birch bark. It doesn't frickin' matter whether it's a GMO corn cob and getting the xylan from a corn cob or taking it from birch bark. It's a chemical, and it is not absorbed or metabolized by the human body. And dentists and even natural dentists believe it's good because it prevents cavities, because it disturbs and kills strep mutans. But strep mutans live in the mouth peacefully when it's in balance. Fusobacterium live in the mouth peacefully when it's in balance. When we try to kill it, oh, thank you, I'm getting worked up here. Anyway, yeah, and by the way, if your dog gets a piece of your xylitol gum, it's poisonous to dogs, but to humans, it just causes wicked intestinal diarrhea and gas. And so when they delivered Spry gum to my office, and the whole staff started eating it, and the cinnamon's pretty good, and this and that, and then the next thing you know, like an hour later, it was like a scene from that movie Blazing Saddles. It was like, oh, well, I got to run to the bathroom and this and that. Everybody's like, they eat the beans and they're sitting around there. Yeah, everybody. It was Fart City in the office. So just because it's natural, don't give it, the reason I didn't do a REVITIN mouthwash yet is because we've been working to try and find something, because REVITIN promotes microbial homeostasis, and it also, you can eat it. It's basically loaded with prebiotics and nutritionals, and that's it. Actually, it's been shown to improve the gut microbiome by 30%. And we have a 40-patient double blind going on right now. Because all it does, and the reason why it works, and you'll see, is because it respects the indigenous flora. It respects our microbial thumbprint. because our microbiome, and I forgot which of the speakers, I think Al, talked about our microbiome is as unique as our thumbprint. It's who we are, it's our identity. So, I mean, this I was really funny because, here is Dr. Mercola, big naturopath, osteopath or naturopath, and, he has this natural mint toothpaste with Tulsi, and it's kill, 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 all right? The reason I was saying we don't have a REVITIN mouthwash is because there's only two things that make it stable on the shelf to be acceptable for a 2-year shelf life, and the two things are parabens or xylitol. So most mouthwash, you'll see xylitol. And I'm sorry, because I picked up some of those cards on the desk, and I was like, xylitol, 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 xylitol. And xylitol, oh yeah, and then they did these studies in Finland on xylitol showing how it kills strep mutans, and that's good for you. Meanwhile, it's a fake chemical that our body doesn't recognize, doesn't absorb, doesn't metabolize, and it goes right through you, and it's very, very disruptive to the oral and gut microbiome. Very disruptive. So we have just found a way to make the mouthwash and using something that is very microbe friendly, but creates unnatural bacterial growth. And it's an ingenious product. We're patenting, so I don't want to get into it, but it is natural. And it is done in a really interesting, natural way. So anyway, so the whole thing here, tea tree oil, this is natural triclosan. And so this was all his ingredients in there. And I said to him, Joe, I was on his podcast, and we were talking, and so he pulled this. He doesn't sell that anymore. So what I did is I basically, when I came out of the Harvard Medical School program, I realized toothpaste is crap. And I was like, I gotta, I was like just praying, please help me develop something that can help people help themselves. Just when you respect the microbial flora, the body self-regulates and heals. That's a key principle of biologic dentistry and biologic medicine. And so the first study we did was a 1 week with a woman who is the editor-in-chief of the Journal of Dental Hygiene, Anita Daniels, who is a wonderful, wonderful dental hygienist, wonderful educator. And she was on the faculty of the University of Miami. And she used REVITIN and nothing else. This is 1 week, 26% reduction. Colgate total had 12 months. I'm sorry, 12 weeks, 3 months. And they had 22% reduction. And they only did 6-month studies in the Philippines. But what we were able to see was that, and she wrote me a letter, because over here, this is a picture she took with 4 days of just brushing, no change other than brushing. And look at the tissue here, and look at the tissue here. And that was 4 days. Gum stopped bleeding in 2 days. Then we went to Italy to stay out of the FDA. And there was Cornelius Pomagé, who was a professor emeritus from the University of Connecticut, set up the study with all these young Italian guys, Grande, Platina, Budi, and Lerda, at Catholic University in Rome. And they did the study, and it was literally like a 10 patients, 10 control. And so it was a controlled study. We kept going through tons of toothpaste. So I fly over there because I'm like, what's going on? They're just finishing the study. And I get there and they're all these like young, like in their 30s, and they're like, Dottore, this is like incredible toothpaste. He said, and I said, look, guys, I thank you, and the study, the results, this was a 14-day now, and they're going, I'm like, guys, where's all the toothpaste going? There's only like 10 patients using the REVITIN. The rest were using the Crest Pro Health. I was like, where's all the toothpaste? And they're like, what? I take it home for my girlfriend and my mother. My mother loves the toothpaste. And this and that. They were taking the product home in the middle of the study, So The reality is that, yeah, what we see is pretty dramatic. And what I really want to make very clear, and I haven't made 10 cents from this company. All I do is put money in. It's like the best product. It's like the gang that couldn't shoot straight, to get this going. But I think we're really gonna have a shot. But I need dental hygienists and dentists to really understand that the efficacy of this is not that this fixes people. It just respects the science, the microbial science. Because if we respect that science, we will, Galileo agreed with Copernicus and the Pope put him in jail for life. And the reality is I want you to understand that this science is very, very disruptive. This product is very disruptive to Colgate and P&G. I was, after I wrote my book, I was going to have a television show on PBS TV. And PBS, it was going to be the Dr. Gerry's mouth-body connection. And it was just all about mouth-body connection. And I would have had people like Blanche come on. I would have had people like Dr. Al Dannenberg, people who are doing interesting things, Dr. Felix Liao talking about his books and this and that. It would have been a great forum to kind of connect this back to this. Colgate offers $1 million as a lead sponsor of the program. Okay? They want to be the lead sponsor. The producers are jumping up and down and they're like super excited because Colgate, they want their name in front of anything with the mouth body. And so I had to now, and I happen to know Ian Cook, who's the CEO and Chief Executive Officer, Chairman of the Board of Colgate-Palmolive. And he's on a committee with me at NYU, the Dean's Advisory Committee, because he gave a very large gift to NYU as well. And so I sent him an email and said, I've got this stuff. And he said to me over the summer, we make incubator investments in organizations like yours. And P.S., to make a long story short, not only did they not invest in the show, but they pulled out of everything. And I said to them thank you. I said to them, this is not meant to kill your brand. This is meant to catch those consumers who are reading the label. Most people will just go to Costco and buy the 10-pound Colgate. So anyway, this guy up here came to me at a biologic dentistry meeting, I think the one we had in Savannah. Oh, no, I was out west at a functional medicine meeting, and I was talking about REVITIN, and he came up to me. This is Sean Lefebvre. He actually said, I just came from my dentist a month ago. This was, I was lecturing in June. This was his June perio chart. Bleeding pockets, 5s, 8, 6. And he said, my dentist wants to do gum surgery and I'm terrified. And he goes, can I get some of your product? I gave him 3 tubes, 1 tube per month of REVITIN. And I said, I want you to brush with it. I want you to spit out and I want you to rub it on your gums and leave it on. Just rub it on like a mask. You could use it as a gum mask because you could swallow it. And I said, use it as a gum mask. Well, this is October. I'm speaking, I think it was Atlanta or Savannah, I forgot. Anyway, he was there. He had his perio chart from June and his perio chart from September. He was holding them and running up to me and going, you're not going to believe this. My dentist said, I don't need the gum surgery. And he said, what the hell did you do? I see a complete change. And all he did was change what he was doing. So this is the first time I ever wrote a HIPAA release on a Marriott napkin and literally scanned these 2 pages into a presentation I was doing that day because it was gone. By the way, furthermore, he told me that these 3 spots also went away. So, you start to rebalance the flora. You see the tone of the mouth change. You see all of these dramatic improvements in the architecture, all by promoting microbial homeostasis. So the 2 other areas I want to talk about, and then I'm happy to do questions and stuff. But lack of exercise, believe it or not, is, so this was Oops, sorry about that. This, I think, was Time Magazine. Exercise alters our microbiome. And it actually helps to produce short-chain fatty acids, which are anti-inflammatory. And finally, and the finale, that we all have to work with our patients, because, you know, I think a lot of people are walking around with PTSD from the past couple of years. And I think mine is like around my waist. You know, so that's, I gained the COVID-19 or 20. but I really believe that we need to really reach our patients beyond their mouth, and we need to reach them in their mind, mouth, body, spirit. And so one of the probably the greatest things that I did from the shutdown is I started meditating again twice a day. And just to kind of shut my mind off and really tune in. But I'm so thankful. I'm actually thankful that I went through all of that, because when I was watching the news and I saw all the lies and all the stuff that was going on, it was insane. You know, it seemed so diabolical what they were doing. And I was like, I couldn't say anything because I was a conspiracy theorist, you know? And so what I did is I went within. And I think that was the message for all of us. The message for all of us was to go within and really find, you know, really take that time to connect from this crown chakra to the source and fill your field up, because that's how we change the world. We change the world when our field is just flowing, when we can project that love and that gratitude for what we are and who we are and what our purpose is on the planet. So the stress in the gut-brain axis, vagus nerve, gut hormone signaling, immune system, tryptophan metabolism. These are all things that happen when you just take 20 minutes twice a day. 20 minutes. Start with 10. I just went outside before I came up here. And I felt totally, because, you know, it's kind of weird. Everybody was eating. I'm like, everybody's going to be sleeping on me. This is going to be a disaster, you know? and you know what? I came in feeling like I was on my purpose here. So really important. Gum disease has a high cost. This is one of the most incredible studies. This study was done by Aetna Healthcare, on 145,000 patients at Columbia Medical Center, Columbia Medical School. And they looked at just doing basic perio, improving the level of periodontal health, resulted in a 21% reduction on average for people. By the way, this is the study that was repeated in Japan. They did the same thing with 4,200 civil officers in Japan. But the Aetna study was the first one. It was a bigger one. It was 145,000 patients. They found that they reduced healthcare costs for the 3 most expensive diseases. You had cardiovascular disease, diabetes, and cerebrovascular disease. It reduced it an average of 21%. It was 23% for diabetes, 21% for cardiovascular disease, 19% for cerebrovascular disease. Does anyone know what 21% savings in costs represents for our healthcare system? Does anyone know? I'll tell you what it is. $750 billion. Should I do this? $1 trillion. $750 billion just improving the health of the mouth. That could make healthcare affordable for everybody if we just wake up and not ignore the 800-pound gorilla. So thank you very much. I really